National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Naturopath Dr. Jonathan Beatty, health expert here at Nationalnutrition.ca. Today, I want to talk about one of the most common complaints I see in my office, constipation. Constipation is characterized by the inability to have regular bowel movements. Many people describe it as if you can't have a bowel movement at least every 3 days, you're constipated. My definition differs quite widely from that. To me, if you're not going every day, you're some level of constipated. And even if you do go every day, the quality of the stool or the quality of the bowel movement can actually indicate that you're actually constipated. If you have those what we call pellet-like stools where your stool comes out as little round balls, that's a sign of constipation. The stool's been in there too long, it's become too dehydrated, and actually the normal peristaltic waves that move stool through your body are actually what's rolled it into those balls. So even if you're going every day, that pellet-like stool can be a sign that you're actually constipated. Okay, so it's not just going every 3 days. If you're not going every day and having a nice sausage-shaped bowel movement without any undigested food, any other major complaints, then you're constipated. Okay, there's a couple of different reasons you can be constipated. There's two types, in fact. There's what we call tonic and atonic constipation. Tonic constipation happens when the sphincter is too tight and it won't open, allowing the stool out. Couple different ways that you can manage that, whereas atonic constipation is actually where there's a lack of tone to the colon and rectum, and there's not enough muscle there's not enough pressure to be able to actually void the stool. So when you have atonic constipation, oftentimes you'll see stimulant laxatives are very effective at managing it, but that's not a long-term solution. You want to look at what's creating that lack of tone or that weakness of the colon muscle. So in order to do that, what we want to do is look at our diet. Oftentimes things that create chronic inflammation reduce the tone of the muscle. Obviously, if your muscle hurts, if it's inflamed, you don't want to use it. So if you're doing anything that's creating an inflammatory response in your colon, that can lead to constipation. On the flip side, if you have what they call that tonic constipation where everything's too tight, one of the easiest ways to remedy that is to actually get yourself a little stool and place it at your feet when you're going to the bathroom and having a bowel movement, and basically get yourself into what they call a squatting position. That's actually the natural way humans are best suited physiologically and anatomically for passing a bowel movement. And when we bring our knees up when we're having a bowel movement, it actually relaxes the sphincter and allows for a much easier passage of the stool out of our body. Other major causes of constipation, well, dehydration, not drinking adequate water. If you don't have adequate water in your system, you don't have adequate water to moisturize and lubricate the stool and make it easy to pass. This causes it to get too hard, making it too large to pass through the anus, and therefore you end up constipated. And that's a very uncomfortable way to be. In fact, chronic constipation can lead to a buildup of the stool that they call toxic megacolon, which can actually become a medical emergency. So it is important that if you do suffer with constipation, that you get it treated. And it's not a deficiency in your diet of laxatives. It's often due to some sort of inflammatory cause, often related to food sensitivities or improper diet. In some cases, it's inadequate fiber in your diet. Fiber is required to give your stool some form to be pushed against. Good soluble fibers bind up water and give the right texture to the stool or the right consistency to the stool so it can be easily evacuated from your body. So that's another thing you'll want to look at. And ideally a good, what they call soluble fiber, a fiber that binds a lot of water. So examples of that would be inulin is probably one of the most common soluble fibers, and it's often available as a supplement. And then from a dietary perspective, another thing that you might consider adding in is psyllium husk or psyllium fiber, as psyllium is very good at binding water up and changing the consistency of your stool into the right form. Now, anytime you're taking fiber, you do need to take extra water because fiber binds water, and if you're already dehydrated, adding in a fiber supplement can actually become more constipating. So ensure you drink in adequate water, take a fiber supplement, eliminate any type of food sensitivities, and get yourself into the correct anatomical position, and you'll have more regular, healthier bowel movements and eliminate your constipation. So I hope you've learned something that you can apply to your own life. And if you like this video, please check out more of our natural health videos, subscribe. Any questions or comments, please post them below. And always remember, knowledge is health.